Hello everyone. This is Silver Queens. Today, we're going to talk about cervical cancer. Screening, an important topic for the health of us middle-aged women. Cervical cancer has a high chance of being cured if detected early. However, many people don't know the importance of screening. Or even if they do, they postpone it for various reasons. Today, we'll take time to learn about this topic in detail. And think together about ways to protect our health. First, let me tell you about the frequency of cervical cancer screening. In the past, it was recommended to get tested every year, but according to recent medical research, it's not necessary to do it that often. Nowadays, it's generally recommended to get screened every 3 to 5 years. Of course, this is an average guideline, and it can vary depending on individual health conditions and risk factors. For example, those who have had abnormal results in previous tests or have weak immune systems may need to be tested more frequently. Do you know how important HPV testing is? HPV stands for human papillomavirus, which is the main cause of cervical cancer. It's not an exaggeration to say that almost all cervical cancers are caused by HPV infection. Therefore, HPV testing can detect the risk of cancer early. HPV testing is said to predict risk more accurately than the existing cervical cytology test. That's why these days, HPV testing is often done together with cytology testing. There are many advantages to HPV testing. First, you can have longer intervals between tests. If the HPV test result is negative, you can extend the interval until the next test up to 5 years. Second, you can get more accurate results. If there's no HPV infection, the possibility of cervical cancer is very low. Third, you can detect risks early. If HPV infection is found, you can prevent cancer by getting tested more frequently or through additional tests. Another thing to keep in mind is that customized screening is needed based on risk factors. Not everyone needs to have the same tests at the same intervals. It's better to create a personalized screening plan considering individual health conditions, lifestyle habits, and family history. For example, those with a history of HPV infection or weak immune systems should be tested more frequently. Smokers or those with multiple sexual partners are also in the high-risk group and should be screened more often. Many people wonder about the necessity of screening after age 65. Many think that screening is not necessary as you get older, but that's not true. In fact, screening can become more important as you age. This is because as you get older, your immune system weakens and HPV that has been dormant can become active. Also, even after menopause, the condition of the cervix can change due to hormonal changes. That's why regular screening is necessary even after age 65. However, screening can be discontinued if certain conditions are met. For example, if you've had consecutive normal results for the past 10 years and no history of serious precancerous lesions, you might consider stopping screening. Or if you've had a hysterectomy, screening might not be necessary. But these decisions should always be made after consulting with your doctor. Your individual health condition and risk factors need to be comprehensively considered. Recently, self-testing kits have become available. These can be a good alternative for those who find it difficult to go to the hospital. With a self-testing kit, you can comfortably collect a sample at home and send it to a lab for results. If any abnormalities are found in the self-test, you must visit a hospital for an accurate diagnosis. Whether you've had the HPV vaccine can also affect your screening schedule. The HPV vaccine can prevent the main HPV types that cause cervical cancer. Those who have been vaccinated have a lower risk of cervical cancer, so they can extend their screening intervals a bit. However, you shouldn't skip screening completely. Just because you've been vaccinated, the vaccine doesn't prevent all types of HPV. Also, if you get vaccinated when you're already infected with HPV, the effect may be limited. So, you should continue regular screening regardless of vaccination status. Everyone, we've learned in detail about cervical cancer screening, but remember, even if your screening results aren't good, don't be too afraid. Rather, be grateful that it was detected early. Cervical cancer has a very high chance of being cured if detected early. Everyone, let's all agree to get regular cervical cancer screenings for a healthy middle age. And through this, I hope we can live happier and more vibrant lives. Health is our greatest asset and the greatest gift we can give to our loved ones. Let's work together for a healthy life. This has been Silver Queens. We support your beautiful middle age.